So Greer, you and I have been working together for a number of years now. What about cannulas? How do cannulas fit into your practice?
I actually love cannulas, and I was just having a conversation with a patient today about the micro cannulas. You taught me how to use cannulas from the get-go. I never had that experience where I was used to doing fillers with straight needles and making all those multiple, puncture holes to achieve the goal. Starting right off with cannulas, I love it because it's safer, less bruising, less downtime, and I feel it's a great service for the patients because they have all the benefits, and not a lot of places offer it. So I'm proud that we use cannulas here.
Mm-hmm. Yeah, I've fallen in love with cannulas as well. As a matter of fact, every now and then I'll use a needle.
Right.
There are some areas that are tough to get to, but the safety profile is so much better for cannulas. And we do a lot of trainings too. So we'll have doctors that come in from out of town. And for me, the most telling thing is sometimes they'll bring their spouse or their office manager in, and we're doing advanced training with Bellafill. So if they bring their model, they'll do half of the face and I'll do the other half. And if they're still using needles, they'll do half the face with needles, I'll do the other half with cannulas. And then their spouse or their office manager will, hey, as soon as we get home, we're buying cannulas because this side hurt much less than that side.
Right,
so,
yeah. And I like the cannulas for areas like the tear trough, that under eye area. It's a delicate area. No one wants to get a black eye. It's really nice to be able to use the cannula safely in that area. I think a lot of practitioners don't treat that area because of the safety. So that's one of my favorite areas to treat, and it reduces swelling after treatment in that area.
And speaking of safety, the FDA just came out with a letter about the safety issues with injectable facial fillers and the risk of vascular complications, causing blindness, causing vascular compromise. And you and I know that when you use a cannula, your risk of having a vascular complication goes way down.
Absolutely.
Not zero, nothing is zero, but much less than with the needle.
Absolutely.